Hi everyone, it's Dr. Ansari. Today I'm going to be talking to you about overactive bladder, and specifically we are talking about conservative therapy. So things that do not require you to take a medication or have a procedure done. This works best in patients who may have mild symptoms, but also in patients who have moderate to severe. You want to really maximize your successful outcomes by layering treatments or adding on treatments on top of these basics that you can do. So first is going to be diet. Now I have a segment called lifestyle that you might want to consider looking at if you haven't already. Diet is going to be very important for all of my patients, like we've already talked about at your appointment. So diet has to do with 64 ounces of fluid, okay, pretty much all water, okay. So 64 ounces of water, but no more than 64, because at more than 64 you might be drowning your urinary system, and we don't want that. You want to avoid certain triggers like acidic foods, okay, carbonation, and caffeine. Okay, these are major bladder irritants, and you want to really avoid these altogether and take in no more than 8 ounces of one of these products in a day. So you can choose your coffee or your tea or your soda. You can't have them all. Just choose 8 ounces of one. That's really the deal here. Now, also, you want to stop drinking fluids 2 to 4 hours prior to bedtime if you have issues with getting up multiple times in the middle of the night. So this might help reduce the number of times that you get up to go. Now, the next thing you might want to consider is bladder retraining. Bladder retraining is a method of that has long-term success, but takes a long time for it to be successful. It basically has to do with increasing the increments at which you go to the bathroom to urinate every week by 10 to 15 minutes. So let's say week 1, you're just starting this bladder retraining, you go every hour, okay? So you go every hour. So then you bring in increasing the time to 1 hour and 10 minutes. So you add in 10 minutes. You make yourself wait. You make your bladder wait an extra 10 minutes before you go to the bathroom. And so hopefully within the week, or maybe it might take 2 weeks, you can increase your time that you go to 1 minute and 1 hour and every 10 minutes. Okay? And you do this every week. You add 10 to 15 minutes on every week until you achieve about every 3 to 4 hour intervals. You can imagine that this is going to take a long time, but it's actually shown to be very successful long term. Okay, so that's bladder retraining. The next thing that you want to consider is pelvic floor physical therapy. Okay, pelvic floor physical therapy. PFPT is what I'm going to call it here. And pelvic floor physical therapy are special physical therapists who work with the pelvic organs and the pelvic muscles to help certain types of pelvic problems. So overactive bladder, stress urinary incontinence, which is leaking with a cough, sneeze, laugh, or prolapse issues, even pelvic pain problems. They can help with a myriad of issues. And the idea here with overactive bladder here is that overactive bladder is a nerve issue where the nerve is misfiring and it's causing you to go frequently. So they will work with you to try to reprogram the nerve by helping the pelvic muscles in a way communicate more efficiently with the nerves and with the organs. So if you could indirectly impact the nerve, this may help with the misfiring that causes the overactivity of the bladder and makes you go often. So pelvic floor physical therapy is another great way of helping overactive bladder, or bringing in, if you have moderate to severe, you might want to bring in pelvic floor physical therapy on top of any other treatment that you decide to move forward with. And now lastly, you might want to consider a pessary if you have a prolapse of the bladder. Okay, not everybody has this, and not every prolapse is big enough to cause an overactive bladder issue, and not every prolapse, if you make it better, if you make the prolapse better, not everybody's overactive bladder gets better, because again, it may be more of a nerve issue than literally an anatomical issue. So the idea here is that the prolapse, the bladder falling or herniating down into the vagina, literally falling in, it's displaced from where it usually sits. And that may cause, in a way, like a stretching of the bladder that induces the misfiring of the nerve. So you can always try a pessary, which is a vaginal ring that goes into the vagina, and they come in different shapes and sizes, and we would fit you for one. And this is a great way to test the idea of whether the prolapse has anything to do with your overactive bladder. So this could be used as a test or as a treatment, okay? Either way. So we place the pessary in, and it lifts up the bladder, and then we can see whether your urgency, frequency, and leakage before you get there improves at all. If it does, then you can continue with the pessary for treatment, or you may want to consider surgery if you are a candidate for surgery to lift the bladder up. Okay, but a pessary is another great conservative option for some individuals. All right, thank you guys.